I know the Food and Drug Administration is concerned about three categories of these dietary supplements. What are they?
Yeah, at least three. Certainly the top ones are the weight loss supplements, the muscle building or sports performance supplements, and then the sexual function ones, which are more often targeting men, but certainly people of all genders are using these products. What we're concerned about in these categories in particular is the problem with adulteration, where manufacturers are deliberately including ingredients that are illegal to be there. They may be prescription pharmaceuticals, they may be anabolic steroids, there may be other kinds of high concentration. As Chuck mentioned, very high concentrations of green tea extract is often in weight loss supplements, and we know that these can be very toxic. They can have drug interactions with other products, and the FDA has pulled out these three categories: weight loss, muscle building or sports performance, and sexual function as basically the most lawless of all the categories of supplements where the most problems are turning up. Just a couple of years ago, the Centers for Disease Control did a study of emergency rooms of finding that more than 23,000 Americans were being sent to emergency rooms every year because of problems with dietary supplements. And of that 23,000, fully 25% were attributed to weight loss dietary supplements, the ones sold for that in particular. Now, the weight loss supplements don't make up 25% of the entire industry, but they are making up a very large minority of the cases where people are being sent to the emergency room. And then thousands, in addition to just showing up at the emergency room, thousands of those are turning into people needing to be hospitalized because of injury. And as you mentioned, I direct a program, Stripe, that's focused on prevention of eating disorders. We're particularly worried about the kinds of categories of products that exploit body image problems, that exploit people with eating disorders or body dysmorphia. People are more likely to be vulnerable to the kind of deceptive marketing of promises of building big muscles or losing weight fast, because these are the people who are most likely to use them, although they're used very widely. Among people who are trying to lose weight, about 45% of women and 20% of men say they've used weight loss dietary supplements. Meanwhile, these products don't work, they're not medically recommended, and they can be harmful.
Peter, we've been hearing about the risks associated with supplements. Can you give us the big picture in terms of adverse effects related to supplements, and more specifically, what are the concerns about supplements for sports and for sexual function?
Sure. So what's interesting is that as Chuck has described, supplements are sold under the broad category of food. And they're actually, if you compare the safety of ingredients that can be added to food compared to ingredients that can be added to supplements, it's very interesting because the bar is even lower to introduce something to a supplement. So let's say you want to spray some preservative into a can of tomato soup that you're selling. That preservative that you're putting into the tomato soup has to meet a certain standard called GRAS that's generally recognized as safe. And that's basically a group of scientific experts have to agree that that product is safe at that dose. GRAS is not the standard for new ingredients to be introduced to supplements. It's a lower standard that does not require anything at that level of scrutiny that scientists need to sit down together and decide this is safe for human consumption. So what we have are products that are being sold to improve your health, to maintain health or improve it. And the bar is exceedingly low, even to introduce brand new ingredients into these supplements. So it's not surprising that although from the regulatory perspective, they're all presumed to be safe, and the FDA's job is to track down the dangerous supplements. But the reality is that many people, like Bryn was describing, are harmed from supplements. And that estimate that the CDC had of about 23,000 people every year ending up in emergency rooms is probably a large underestimation of the dangers of supplements. And the reason is that in that study, it was based on Sentinel emergency rooms, 63 emergency rooms throughout the United States that the CDC was tracking. And they had no special training of the providers in the emergency room to detect or to even ask about supplements or to detect supplement harm. So what they did is they just reviewed the records, the charts of patients who came to the hospital, and they found that an estimated national estimate of 23,000 people ended up in the emergency room due to adverse effects of supplements that just happened to be noted by the physicians with no particular training. So that's a very low estimate of probably how much harm is going on. So what's interesting here is this parallel between what the law requires about safety and expects about safety, and the reality. And we have a real disconnect between those two. And again, what my team of the analytical chemists that I work with and we study particularly is that in these products that Bryn's mentioned, those categories like weight loss and sports supplements, what we're finding is that many of the products contain novel pharmaceutical-like substances. So it might contain not amphetamine, because amphetamine obviously is a controlled substance, not legally sold, but it might contain amphetamine when the methyl group or a few carbons are moved slightly on the molecule to something that would appear at first to fly under the regulatory radar screen, even though we, in many cases, have early data, sometimes even human data, that version of amphetamine or that version of methamphetamine, which we've also found in supplements, has pharmacological effects. So those are some of the issues that we're particularly interested in.